Hello, my name is Arunabh Das Sharma. I am a diabetic. I had been a diabetic for about 6 years, and because of that, I developed some complications in my foot, which is normally called a diabetic foot.
My name is Gayatri Das Sharma. I am Arunabh Das Sharma's wife. We came to Dr. Choudhary to show the foot to him. And, initially it seemed that, it's a question of debridement, the foot would get okay. But because he's a diabetic and there wasn't enough blood flow to the toes, the situation got quite complicated.
The problem was very serious because the third and the fourth toe in his foot was actually totally black and gangrenous, and it was very smelly with infection as well.
But then he saw it and said that, surgery is needed, where they needed to amputate 3 fingers from my foot because the infection had got too much. So we decided that, if the surgery needs to be done, it should be done quickly.
And I think that's really where you need the medical opinion of a doctor, but also you need, you need compassion and kindness. And I think that's really what Dr. Choudhary and his team did for us.
We had to amputate the toes which were already dead, and we surgically debrided, which essentially means removing all the necrotic tissues, and basically started the wound care management of the foot. So we started, hyperbaric oxygen therapy for him. Hyperbaric oxygen therapy is essentially a chamber where the patient sits sealed completely like a pressurized cabin and gets 100% oxygen under increased atmospheric pressure. Patients who have deficient blood supply in the foot, essentially by increasing the level of oxygen in the atmosphere, you increase the concentration of oxygen in their blood supply, the blood vessels.
I went through 2 rounds of surgery first. One was to do the amputation, and the second was to, clean up the pus and the infection that had got built inside. After that, I was on the wheelchair for many months, I think 4 to 6 months.
Just, holding us times which, were very difficult because the healing wasn't happening. Supporting us when we came to the hospital because we were coming every single day to the hospital, and they understood how both physically and emotionally tiring that was.
But now Arnav is walking without a stick. Today we had a stroll in the hospital together, discussing a lot of things about his work because he's joined back his work. He even is playing a 9-hole golf, and I think he's really achieved a good quality of life, almost near normal quality of life, from a state where he was about to have an amputation.
And the results are in front of us. My husband, by God's grace and all the work that the team has put in, the support that we've been given, is able to walk. I think gratitude is a very, very small word. I think we owe a lot more than that to Dr. Choudhary and his team.
So the message from me is that if you have an ulcer or an injury, and if you're a diabetic, you must see a specialist as soon as possible. Plastic surgeons are wound care experts as well. So if possible, you should go and see a plastic surgeon so that a proper wound care can be done and a good functional salvage of your foot can be done.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.